Hi everybody, I'm Emilia. I'm a patient coordinator here at Mexico Bariatric Center, and I'm glad you're here. Let's get started on going over all the details. And the biggest subject of this Q&A today is to kind of go over the top 10 bariatric myths, because there's a lot of information out there. There's a lot of things that can confuse people and misinformation and all that stuff. So we definitely want to debunk all of that. And no, we're not going to go through like every single one, but for sure like the most popular ones. The first one being bariatric surgery is a quick fix. So that's not 100% true. We like to say, or at least I like to say, that these surgeries or procedures that we provide or offer are more of a tool than anything else. They can help you for sure to get to, your ideal body weight and overall, healthier BMI. But don't think of it as like, oh, I have surgery, I'm good now, I don't have to worry about it, I'm never going to gain weight again, I'm never going to have to worry about exercising. Like, unfortunately, that's not how it works. Medicine has not gotten there yet. So it's a tool to help you get to the end result. Of course, you will lose weight because it is a surgery at the end of the day, it is a procedure. But that alone in and of itself is not going to be enough for your long-term success. And that is why we try to emphasize the importance of your lifestyle changes, nutrition, exercise, healthier habits overall. It just all goes hand in hand, because no matter what procedure you get, technically speaking, it is possible to regain weight. And so it comes down to each individual's, strength or like will to actually continue the healthier lifestyle habit changes. And it's hard, right? It is really hard because a lot of it comes down to like having to change a lot. And sometimes doing it cold turkey is not the best answer. Sometimes it is. You gotta know yourself. You gotta like figure out what works for you. And, just remember you're human. Life happens. So don't be too hard on yourself either. But yes, we are here to help you achieve those long-term goals for yourself. The second myth is that bariatric surgery is all cosmetic. No. So bariatric surgery is specifically weight loss surgery. So cosmetic surgery means like your tummy tucks, your BBLs, your breast augmentation, your mommy makeovers, like all those things. And cosmetic surgery is more on like the outside as opposed to like helping you from the inside, which is bariatric surgery. Because bariatric surgery literally targets your stomach, like your actual stomach pouch, your intestines, like all that stuff. So it is very, very different. And if you've never really known the difference, like we can send you a bunch of information on the differences between bariatric surgery versus cosmetic surgery. Now here at Mexico Bariatric Center, it's literally specifically just bariatric surgery, but we do have a cosmetic center, Mexico Cosmetic Center, that also operates and works at the same hospital that we do, because it's all under the same overall company, but they're two very different branches. So if you have any questions about that, please again reach out to coordinator so that we can send you more information about that. So number 3 kind of goes back to number 1. I touched on it a little bit with the whole like regaining weight and stuff like that with any procedure. So the title says most people who have the surgery gain the weight back. So again, yes, it is possible, but it's not necessarily 100% true. Because again, it does, has a lot to do with each person's individual, lifestyle changes again with nutrition and exercise and all that stuff. but about 30% of the weight loss surgery patients regain most of the weight regain most of the weight lost within the first 5 years of having had the surgery. So that means about 70% actually maintain their weight loss even after the 5 years. So a lot of the time, even after, you keep the lifestyle changes and you keep up with your diet, you keep up with your exercises, you keep up with all that stuff. Like I mentioned earlier, life happens sometimes, and stress is a huge factor in why sometimes a lot of these patients do come back for revisions, because stress is like the number one enemy for weight gain. It's very hard to lose weight when your body, especially the cortisol levels, are so high. So that does happen, which is very normal, but it's not your fault. Again, sometimes it's just biology doing its thing. But we do offer revisions in those cases to help kind of give you like the next step, because sometimes some people do need the next step of like a little bit more aggressive procedures. Not because they're doing anything wrong, it's just their body, reacts differently to the surgery that they got the first time. So, but there are options. There's always options to help with that. So let's see. Number 4 is eating and drinking at the same time. So drinking during a meal, especially soda, can definitely push through your stomach faster and make you feel full, or make you feel less full. So they do recommend, the nutritionist does recommend that you wait 30 to 60 minutes before or after any meal to drink again. So there's this like 30-30-30 rule that we have a blog about. Hopefully Sarita can enter it in the chat here, but just keep in mind that like things are going to change. Like you're not going to just be able to go back to eating and drinking like you used to prior to the surgery, because there's so much that's changed in your, like literally your insides. So your stomach is not going to be able to process things the same as it used to. So just that is a huge thing that you have to keep in mind when you're going to be going through these surgeries, is things are going to change and it's going to be an adjustment, but that's why we're here. That's why we have a certified nutritionist. That's why we have a surgeon liaison. We have a fully equipped team to help give you the success, get you to your success like goals. So don't be afraid to ask questions. We have these specialists, these professional like specialists that know what they're talking about, know what they're doing. So anything nutrition, vitamins, please reach out to the nutritionist. He will be more than happy to answer all your questions, especially like for the post-op changes and things like that for food. So the next myth is that my stomach will stretch back to its original size. That is false. It is actually natural and healthy for your stomach pouch to stretch over time to properly recover from the surgery. However, your stomach pouch won't stretch back out to its original size. It's just like physically impossible for it to like fully stretch back out to how it was. A lot of people think it's overstretched or it's stretched back out like to where it was because they don't feel full anymore, or like the restriction is completely gone. And those things can happen, but it's not because your stomach has like completely gone back to where it was. But there are some tips to help manage the stomach pouch, kind of stretching back out a little bit, which is, of the basic ones: avoid overeating, don't skip meals. That's a huge one too, because I feel like a lot of patients that say that they started to gain weight again or they're not losing weight after having had the surgery is because their stomach pouch stretched back out. And that's not the case. It's actually, if you don't eat food, like if you don't eat what you're supposed to be eating, it can technically be really hard for you to lose weight. I know that sounds like counterproductive or whatever, intuitive, but that is true. Like if you skip meals, it can cause weight gain. Watch out for emotional eating. Again, kind of goes back to what I was talking about earlier. Life happens. Stress is a huge thing. And when we get stressed, a lot of us tend to reach for, the sweets, the salty snacks, like the quick, munchies sort of thing. But just keep an eye on that, because that of course, it's not going to help really benefit you in any way. And the last one is to protect your stoma, which is your new stomach pouch. Just, keep in mind, like, all the things that, like, you technically should try to be avoiding eating after your surgery. Again, if you have any questions about this, please reach out to the nutritionist and the surgeon liaison too, since she, like I mentioned, she's a medical professional who specializes in bariatric surgeries and patients. So she would definitely be able to give you a lot more, like, scientific information on how it all works, specifically, like, after surgery. So I would highly recommend reaching out to her too. And if you don't have her contact information, you could always ask your patient coordinator, or if Sarita can put it in the chat here below, that works too. Let me see. Number 6, drinking carbonated drinks. So that is something that is highly advised for you to stop drinking, or try to avoid sodas and sparkling soft drinks and things like that. Regular sodas and carbonated drinks contain a lot of sugar and calories as it is, so that can cause weight gain as well. Diet sodas with 0 calories can also cause certain hormonal reactions, which can store more fat in your body. So just because it's got less sugar doesn't necessarily mean it's better for you. Just keep that in mind. Soda can also, it's been found to make people nauseous. So that's something that the nutritionist can definitely explain a little bit more on. So we do always highly recommend, sticking with water, tea without caffeine, coffee in moderation, because I'm an avid coffee drinker myself. But it is, it's about, like it says here, moderation. Don't overdo it. And other non-carbonated drinks are better overall. Number 7, drinking from a straw. So I have heard patients mention that they've seen or were told that drinking from a straw is, like, forbidden after having surgery. So there's some truth to that. Using straws or chewing gum can get air into your new stomach pouch, and it can create painful air bubbles, which will rise or fall based on your recovery. This can also make you feel like a make you feel full and take up space in your pouch, which should be filled with proteins. Again, kind of like I mentioned earlier, it is really important for you to actually eat foods after your surgery, like once you're able to help maintain healthy body weight. Because if you drink, like, pure liquids and you feel full, your body is it's not really getting nutrients that it needs to be, like, healthy, to get to your ideal weight. If that makes any sense. And if it doesn't, I'm sorry. But you could always ask the nutritionist for sure, because he knows obviously more about all of this information. So number 8, the myth is that I will see results right away. So this is kind of like a gray area, but obviously you're not going to, like, have surgery and then you're going to be down, like, 40 pounds in, like, 2 days or the next day. It does take time, so that it is a matter of being a little bit patient. We have patients that lose weight faster than others. It's just everybody's body reacts differently to the surgeries. So don't feel discouraged if like you hear somebody that had surgery the same day as you has already lost like 30 pounds in like 2 months, and you're only down like 10 pounds. So it's everybody literally loses weight at a different rate. There's just a very general idea of like how much you can lose within the first like 3, 6, 9 months, year. But just keep in mind that if you're doing everything you're supposed to be doing with the post-op diet and care and diet and exercise, like you'll get there. You'll get to your ideal, weight and like your end goal. It's just a matter of patience, which I know is very hard. I have a hard time being patient with myself sometimes. So it just takes a lot of that self-awareness. But we do have like a weight loss calculator on our website, so you can try to estimate to see how much you are supposed to be, like what range you're supposed to be at, like for losing within like each month kind of thing. The next myth is that weight loss surgery is very dangerous. So we hear this a lot because we do see a lot of botched surgeries in the news, and that's usually what makes it to the news, right? Like to the news outlets is all the bad stuff, all the scary stuff, because that's what sells. But I digress on that. Of course, any procedure at all, any surgical procedure has risks. It's just common sense, right? Like even if you're just going in to like get your, like, because you cut your finger open or whatever, you're going in getting stitches and stuff. Worst case scenario, you get infected, something happens. Like, there's risks with anything. As soon, like even just waking up, getting things like that. But our number one priority is your safety and your well-being. So that's why we have the surgeon. Our surgeons are the top surgeons. At least we believe in these fields, in bariatric surgery. And I feel like our results speak for themselves. You can look up their information, all their certifications. So we just always highly, highly advise you to do your research properly. And that way you're just well informed prior to going or prior to moving forward. So that is a thing. It's like, is it dangerous? It's like, yes and no, no and yes, just because of the fact that it's like any surgical procedure has risks. But ultimately, without weight loss surgery, you do face an even greater risk that you, like for patients that have high blood pressure and diabetes or joint pains, those things can get worse over time. So we definitely don't want you to like wait until you're in a more like debilitated state to finally do these things or to finally get surgery. We want to try to avoid that. And that's why we offer these procedures, is because we want to make sure that you get to be like the healthiest, best version of yourself. We do take that very, very seriously. We have over like 25,000 success stories. Most of our surgeons are, double board certified. We are a US based company, and everything is fully like legalized and like done properly to the T. But again, do your research. That is my biggest advice to you, is do your research properly, so that you feel confident also in your decision, because at the end of the day, it is your decision and we want you to feel comfortable with it. We don't want you to just rush into something and then feel like you were just kind of blindsided. We definitely give you all the information prior to you going, prior to you making a decision, because we want you to be well informed about everything. So the last one is eating large amounts of food after surgery. Definitely avoid overeating. While the pouch makes you feel full with less food, overeating can excessively stretch out your stomach pouch and make it easier to gain weight, kind of like what we touched on earlier. You can prevent this by measuring your food, taking your time during a meal, and being careful when you feel full. Just listen to your body. That's like the biggest thing that I feel happens a lot of the time is we don't listen to our body because our body tells us when we're full. We got to look for those cues. And it could be different for everybody, but if you truly listen, like you feel out, like take time to like eat your food, chew your food, like you'll start picking up those cues of like your body telling you like, okay, that's good. But yes, measuring food is another big help as well, because then you literally are only serving yourself what you should be eating, no matter what. When you're getting full, try writing down exactly how much you've eaten to learn what your limits are and listen to your body. My biggest tell is I get hiccups. I know that's like a pretty common one, I guess. But I get hiccups when my body is like full. I try not to get to that because then it's kind of, I feel like I'm at an uncomfortable full when I get the hiccups. So I try to listen to my body prior to getting to the hiccup stage. But again, you know your body better than anybody. So this whole process and this whole like getting weight loss surgery is kind of like also learning how to like love yourself, trust yourself, because there's a lot that goes into accepting, you know, all of this, like accepting that you need the extra help, accepting that things will be different. So it's like a whole like journey, basically like a self-love journey that you're going through. So we take pride in what we do here, and we definitely want to make sure that you feel that pride and that you feel like you have the support to make these decisions, because they're life-changing decisions, absolutely life-changing decisions. But we want to make sure you feel comfortable making this life decision. It's scary because it's different from what you're used to and what you're doing every day and what you've been doing. But that's the case with anything, really, if you think about it. So just keep that in mind, that if you ever have any doubts or any concerns, anything like that, that's what we're here for. Your patient coordinators. We literally, our job is to help you, not to just, book you and then goodbye. No, we're literally here like every step of the way for the most part. So we're your support system. We have a bunch of support groups, as you guys know, on, Facebook. So I highly recommend to, get on those, ask your questions. Everybody's super helpful. And if there's an answer, like if there's a question that needs to be answered by like your coordinator or something more specific, Sarita, she's our oh my gosh, social media guru. Sorry. So she's always on it, and she will definitely get you the right answer, or she will get the person to get you the right answer. So trust me, you are not alone through any of this. It is a big journey. It is a long journey sometimes, but you're not alone. You got this. If you have any questions, any concerns, please reach out to your coordinator, and I will assure you they will make sure to get you the correct answer. If not, they will point you in the right direction of who can answer that for you. So as always, thank you so much for joining me. If you ask questions in the chat, I am sorry if I did not get to them, but Sarita was definitely trying to get to most of them for you guys. She'll continue to answer them even after. So keep asking your questions, and she'll throw the answers in there. But thank you guys so much. It was really nice getting to share some more information for you guys. And thank you.